Welcome to this session. Today we are going to review a BSN NCK examination past paper that was done in January 2008. This was paper 4, but currently most of this content will be found in paper 2, right? Okay, so let's get right into it. The first question, we have a widow decides to become a soldier in response to her husband's death in war. This type of defense mechanism she's using is dash. Alright, looking at the 4 options, that is reaction formation, identification, sublimation, and displacement, we can maybe looking at the first one where reaction formation. Of course, we know reaction formation is a defense mechanism where you find that someone will behave in a way that is opposite to the one's true feelings or distress. Like if you are annoyed by your boss, you could pretend to be so happy about the boss, and that is reaction formation. So it cannot be for this case, right? Okay, then we have sublimation, the C, sublimation, right? Sublimation simply involves redirecting socially unacceptable impulses into socially acceptable action, right? Like somebody who is so violent in the society turns out to be a boxer or a wrestler, right? That is what sublimation is. What about option D? Option D involves transfer of grief, right? Transfer of grief. Like the dad comes at home, he's so annoyed by the boss, he makes the mom to be annoyed. Mom also transfers the problems to the daughter does it to the cat, and so on and so forth. For that reason, option B is the best one here, identification, right? So this widow in the process of mourning and grieving has decided to identify with what the husband was doing, right? And that explains the mechanism, right? All right, guys, we have we have several defense mechanism. Maybe you could use this link to just review some of them. Let's look at question number 2. A type of personality disorder in which a patient presents with self-dramatization, craving for novelty, and self-deception is. All right, looking at option A to D. If you have paranoid, I think paranoid is always associated with suspicion, right? Suspicion, I think, which is not reflected in our case here. Obsessive compulsion is related to people being so rigid and focused on their roles. I think it is also not in this case. We also have the narcissistic, that is D, narcissistic. And narcissistic, these one are people with grandiose, right? The grandiose people. I think what is closer to what we want, we are looking for a drama queen who, most of the case, they are diagnosed with these histrionic personality disorders. Guys, we have 9 groups of personality disorders. You can use this link to review those different disorders. Number 3, we have the neurotransmitter implicated in pathophysiology of primary degenerative dementia of Alzheimer type is, ladies and gentlemen, you have several neurotransmitters there. As you know, Parkinson, dopamine, this one is normally involved in conditions like Parkinson's disease. Substance P is all about pain perception, right? And GABA, that is gamma aminobutyric acid, this one is implicated in conditions like anxiety and seizures. So the only neurotransmitter related to Alzheimer is acetylcholine, right? Acetylcholine neurotransmitter. The minimum age for voluntary patients to be admitted into a mental unit or a hospital is Ladies and gentlemen, in many jurisdictions, I think the minimum age is 18 years, right? And maybe you could share, maybe those other guys from other different countries, you can share and tell us maybe what will be your minimum age. But in most jurisdictions, including Kenya, is 18 years. A motivational syndrome is associated with abuse of motivation, right? Of course, we know this is the absence of motivation, right? So, looking at the option, if you look at opioids, what we really know about them is they have a lot of, they cause a lot of dependency and withdrawal symptoms, hallucinogens, amphetamines. Amphetamine, this one is a stimulant, so it can't be a motivational, okay? It will be motivational, right? I think a motivational is more associated with the schizophrenia, and one of the major causes of schizophrenia in most of our setting is the cannabis, right? The cannabis sativa. The principle of reciprocal inhibition is used in. Alright, when looking at modeling, it's all about observation and imitating. Flooding, you are trying to expose a person to fear. Aversion deals with unpleasant images and mild shock. So systemic desensitization is where you gradually expose a patient to a feared stimuli while simultaneously engaging them in relaxation techniques, right? And that's what gives us the best option. The management theory that explains a situation in which managers uses threats and close supervision in dealing with staff is, so looking at all of these ones, you can start with the Hexbag's two-factor theory, and this one is looking at patient dissatisfaction and patient satisfaction, right? Which one is the opposite of the dissatisfaction and satisfaction. McGregory's why is all about empowerment and supporting the patients, while Vroom's expectance theory deals with motivation through belief, right? Where you're using threats is what we refer to as McGregory's theory X, right, as the correct option. A form of communication that coexists with formal communication channel is which one? Looking at the diagonal communication, you could find maybe a manager in one department talking to a junior staff in another department. Lateral, it could be peer-to-peer communication, vertical communication where you're getting maybe flow of information from subordinate superiors or vice versa. I think grapevine could be the one that's best defined here. Form of communication that exists with formal structure of communication is the grapevine communication. Change that involves mutual goal setting and equal power ratio and deliberativeness is referred to as. Looking at this, all of them, natural change is normally spontaneous. Coercion, it involves the use of power to convince people. Interaction, that's a normal reduction. So, change that involves mutual goal setting, this is what is referred change. The best methods of collecting data in ethnographic research. Remember, ethnographic research is about qualitative research. So, looking at option A about telephone interview and questionnaire, this is more structured and less immersive, so it might not be used for qualitative data. Structured interview and Delphi. Structured, of course, it's more structured. Delphi, this one is normally used by the experts. Semi-structured and questionnaire, right? We already said that the questionnaire are more structured, so we rule them out. the best option will be the use of focus group and unstructured interviews to collect this qualitative data. Number 11, an interaction effect can be best be examined through interaction effect, right? If you look at simple hypothesis, this cannot capture interaction, right? It causes an hypothesis. A complex a null hypothesis, there is usually no relationship between those two variables. Simple directional hypothesis, this is going to be predicting specific direction. So we could have a complex hypothesis as best option for us here. An example of a quasi-experiment research design, right? We have several, like the Solomon 4 group. This one is a true experiment. The pre-test, post-test control group. So an experiment. Post-only control group. Post-only group. I think the best that you can use for the quasi-experimental design is the time series, right? The time series that involves repeated measures over time, say at 3 months, 6 months, so on and so forth. You are sampling from a population which you divide into male and female. This kind of sampling is referred to as, we have those options that we have here. So systemic sampling is where you do sample at regular intervals. So we normally take off the nth. You could say maybe your nth is 5th. So after every sample you select one. Okay, if you are counting individuals, you could say after every 5 you consider that. After every 5, the nth interval, right, as the interval. Stratified sampling. So you're going to divide in subgroups, or some strata. Cluster, this one you normally use geographical, and syndrome random sampling is where everyone has a chance. So this one could be stratified random sampling. An accessible population is one that is one that majorly the researcher can reach from where she or he and doing the study, right? The one that meets the criteria, of course, this one is normally the target population. Socialization to an organization involves socialization. Correct. You are trying to share attitudes and values through role modeling, myths, and legends. Remember, job description as part of the orientation, right? Socialization. That's option D will be the best. 16. The component which belongs to cognitive domain is. Okay, remember according to Bloom's taxonomy, we normally have CAP, right? Where you have cognitive, attitude, and psychomotor. So cognitive. So when you look at perception is what? Yes, the attitude. As we have attending is also an attitude. Valuing is an attitude. The cognitive, the best is the synthesis. Reliability of a test means what? Reliability of a test means the consistent which the test measures what it is supposed to measure. Right? Remember, the extent to which the test measures what is supposed to, that is what is commonly referred to as validity, right? Validity. Whereas the extent to which a test can distinguish different students, students' performance, that now will be discriminatory power. While the extent to which a test is practical to its purpose, that is the practicability, or what we commonly refer to as the feasibility. The view of a teacher as a facilitator of learning is attributed to, all right, when you talk of Abraham, we always talk about the hierarchy of needs, so we can only use it to motivate the students. Jean Piaget is known for cognitive development of humans. We have the Albert Bandura, with this one is related to the social learning theory, while Carl Rogers talk about the humanistic education. So in that case, this is what is closer to what we need about facilitator learning, facilitator teacher as a facilitator in learning. A student who always complains that the teacher does not teach well while himself is doing very little to improve his performance has what? Okay. So when you blame yourself, that is internal. When you blame others, that is external. And if you look at the option, if it is A, then this could say that he believes is the problem, but in this case, it's not the case, right? Low intelligence, that now we're going to be testing cognitive ability, right? A lot. So if you look at external loss control, that means you are placing blame on external circumstances, be it your teachers, your parents, and so on and so forth. So this is the best option here. NAS teaching is the kind of teaching that NAS teaching, okay, the client requests, you're supposed to assess and know what is the need for the patient. NAS believe the family requires, no, we're talking about the patient, not the family, right? This is not a family, that is a patient, right? So NAS believes that the patient will require, so based on your assessment, you identify the patient needs. Okay guys, the other questions were explained 4 extrapyramidal side effects of drugs. So here you look at this effect of the tranquilizers, right, which are several, right? The second one was you state 2 importance of informal organization structures, which are several also, followed by explaining 3 differences between quantitative and qualitative. You can also be able to distinguish between the two. You're also supposed to define depression, explain monoamine neurotransmitter theory, and stage 2 nursing diagnosis for a depressed client. We have already done it. Nurse managers use teams to achieve specific organizational goals. You're supposed to explain 3 characteristics of an effective team. So you can have several characteristics. Step 2 consideration you take into account when discussing research findings. You discuss several of them, right? Outline 3 aspects that will be considered during cultural assessment. So during cultural assessment, you look at these different factors. Defining approach conflict and giving 2 examples. Okay, approach, that's the definition, and we have several examples on our right. Define education according to Ralph-Taylor and some components of curriculum according to the Ralph-Taylor, right? So that's Ralph-Taylor, who defined education as a process of changing the behavior of students through structured learning experiences. Ralph-Taylor emphasized that education should result in observable changes in a learner's behavior, skills, and attitude. And the components of curriculum development according to Ralph-Taylor include defining objectives, selecting learning experience, organizing learning experience, and evaluating the progress. Remember, this model is referred to as Tyer's rationale, which forms foundation of many developmental curriculum development frameworks, right? Remember, paper 2 topics will involve these ones. If the question is not from community health nursing, it could be from primary, environmental, communicable diseases, community health and diagnosis, special health issues, home visit, home-based care, mental health and psychiatric nursing, sociology and anthropology, research in nursing, leadership and management, teaching and learning methodology. Thank you so much and see you in the next review.